Dr. Stephen Reisman, who is director of the New York Cardiac Diagnostic Center, a cardiologist and a nationally recognized nuclear cardiologist who was part of the team at the Cedars-Sinai Medical Center in Los Angeles, instrumental in developing many of the early technologies in nuclear cardiology. What about nuclear cardiology? Let's meet our very special guest, Dr. Stephen Reisman. Doctor, good morning. Good morning.
Thank you.
Thank you for being with me. Boy, I'll tell you, this is dramatic stuff, isn't it?
Absolutely.
Tell me, just so that my radio audience will understand, nuclear cardiology. Could you explain it?
Nuclear cardiology is a technique, and some of them your listeners may be familiar with this, which is basically a stress test with cardiac imaging, where we actually look at the blood flow in all the regions of the heart during exercise in an attempt to prevent heart attack, basically, and look at blood flow irregularities early on before a heart attack.
You know what I'm amazed at? I'm amazed at doctors like yourself, and you read about it and you hear about it all the time. For example, the young serviceman that had both of his arms replaced. I mean, you folks you're just brilliant. That's all.
I appreciate it. Thank you.
I can't even imagine anything like this. And when did nuclear energy, in a way, that's what it is, when did this become a part of medicine?
Well, this really got going in the late 70s and early 80s, and it's been perfected over the last 20-plus years. And we do it now, for instance, in our office in Manhattan. We do it on a daily basis. It's very easy to be done. And it's really the most comprehensive type of stress test to really look and see what your cardiac risk is. And, you know, we're very involved with cardiac risk, but also with prevention. For instance, on our website, www.newyorkcardiac.com, we have a lot of tips for patients in the blog area and for individuals in general about prevention, weight loss, exercise, diet, nutrition, things like that. So that's a big part of what we do.
Now, doctor, you're saying this whole nuclear process helps with weight loss, too?
No, the nuclear process is going to predict who's really already has a problem with blood flow abnormalities to the heart. It's going to catch it, hopefully, before you have that heart attack and damage to your heart.
And you can make an appointment? I mean, is this prevalent all over the country?
Yes, this technique is all over the country, and it's really an excellent way for seeing if you've got some risk factors of heart disease. And what are the risk factors? We're talking high blood pressure, diabetes, obesity, smoking, family history, high lipids. If you have any of those things going on, you should be thinking about seeing if you're at risk for a heart attack. Dr.
Stephen Reisman, director of the New York Cardiac Diagnostic Center.
My pleasure.
Why is it now, doctor, it seems to me, maybe I'm wrong, but there's more and more diabetes with younger and younger people?
Absolutely. And there's no doubt that obesity is a big contributing factor to this. We know that over 60% of the U.S. public is either overweight or obese. 60%.
Wow.
And obesity has a clear effect on the blood vessels. They're more apt to build up plaque. You're more likely to have diabetes, which is a syndrome primarily involved with elevated blood sugar, something that's easily tested with a simple blood test. But this is having a big factor on causing a lot of our problems.
You know, again, when you go on a diet, and you see on television some of these crazy, I think they are, maybe they're not, but crazy diets, and the people lose weight, but then they put it back on again.
Right, so you need to have a healthy diet. Again, on our blog section on our website on NewYorkCardiac.com, we talk about things such as the Mediterranean diet. We talk about fiber, fruit, vegetables, things that are healthy, and you also have to exercise. The critical thing is you need to be walking at least 30 minutes a day briskly, at least that amount, 5 days a week. If you can do that and then combine a diet with that, odds are you're going to start on the right path in the right direction.
Can you give me your website again? I'm sure many of my radio audience would like to go to it.
www.newyorkcardiac, spelled out, newyorkcardiac.com. On top there's a button that says blog. Just click on that. Read through that. You'll get tremendous information for prevention.
Dr. Reisman, thank you so much. I've been wanting to talk with you, and I finally did.
Okay, my pleasure. Thank you.
Dr. Stephen Reisman, he is the guy, director. I read about him. I read about him in Forbes magazine, a great story. Director of the New York Cardiac Diagnostic Center, and you got the website. Again, you know, when you stop to think about this, I was watching one day. I don't watch him regularly because I'm not home, but I was watching Dr. Oz one day on Channel 3, and he was talking about this very same thing about overweight, and he had some women who were absolutely overweight, and evidently he's on this kick about weight loss, and it's important. It's important what you eat and staying in shape. But I didn't realize you had to walk that far every day. That's interesting. So you might want to go to his website.